Also, doctor, you said something about soaps. So the market is full of face wash, right?
Yes.
And there are some which claim to be herbal and Ayurvedic. So how do we differentiate and know from that which face wash we can use and which is lighter for our skin?
Yes. So ideally, I would want you to go and check the pH of these face washes. The pH of the skin is 5.5. Now, to be honest, there was a time when we had asked for the pH of all the soaps that are available in India. So the international brand Dove soap was the one that had done this test, and they found that the Dove soap was neutral pH of 7, neither acidic nor alkaline. So that's a very easily available soap that is internationally available. And I think if you can't remember any names, just go for Dove soap. Okay, that is for the body at least. And for the face, depending on what problem you're facing, if it's a really dry skin you've got, use the cleansers. So Cetaphil is a Galderma product, the company Galderma, which is again internationally available. So I will spell that out. Cetaphil, Cetaphil.
Okay, so the cleansers should have this Cetaphil.
Cetaphil is the name of...
Cetaphil is a brand name. Is a brand.
Yeah.
Is a brand. It has cetyl and sterile alcohol. Now, these are things they may not remember these words. So I thought, Cetaphil is internationally available. So, everyone is going to get that.
Yeah,
so,
it is available in UAE because I have it at home.
This is a cleanser, is it? This is a cleanser?
Yes,
face
it's a
wash,
cleanser.
Yeah.
It's a face wash you can use to wash your face. People even bathe with that. So there are larger, gallons also prepared for body washes. Yes, absolutely.
Oh, yeah. Thank you, Vijay. Vijay is showing that image.
Absolutely.
Yeah, so please tell us about the sunscreen also. You were telling about we can use sunscreen throughout the day. So which sunscreen should be good for us?
Pears face wash? No, I think Pears has a pH of 8.
No, okay. She was talking about sunscreen. A pH level of 5.5 is what Anjali she has recommended. And I think Devi has already put it on the chat.
Okay, fine.
Yeah, you can ask the next one. Thank you, doctor, for repeating all those information again.
Most welcome.
Thank you so much.
Yes, so sunscreen, no, sunscreen ka pH level nahi hai. This is the skin pH level 5.5, and the cleanser should be as close to it as possible. A sunscreen is something that is applied on the skin, or you can even take in antioxidants as the oral sunscreens, but I'm not a big fan of any chemical application on the skin. So if you have absolutely no problem and you just need to protect your skin, aloe vera is one of the best sunscreens I know. So a concentrated aloe vera gel or a cream can really work as a wonderful sunscreen. And I'm a believer in food. So if you were eating a diet that is rich in antioxidants, you are not going to need a sunscreen. But if I have people, having a very low diet, a diet low in fruits and salads and raw foods and alkaline foods, I will have to prescribe an oral antioxidant like Entoxid HC is available in India. There must be something similar abroad. And what else can be? Sunscreen as an application in India, there are a lot of brands. Internationally, I think La Shield is available. Cetaphil UVA and B is available internationally. Banana Boat is available. Neutrogena is available. These are all very safe sunscreens. It's all about compliance. So if an oily skin person is not going to like a very thick and heavy sunscreen on the face because they're already fed up of the oily feel on their skin. So they would like something matte finish. And La Shield is a matte finish sunscreen. And so is the Cetaphil UVA-B wala. But if you have a really dry skin, then I would prefer that you all pick up a sunscreen with a. So in India, we have a brand, Revela lotions, Revela sunscreen lotion, which is available in all formats, a gel and a aqua gel and a lotion format. So if you have something that is called a sunscreen lotion, then that is for a dry skin and you can use that. But sometimes it is up to us. We don't like the feel of a certain sunscreen. No worries, you can try another one. So what is an ideal sunscreen? You look out for a word called SPF. There's a sun protection factor. Now, in a tropical country like India, 30 and above is what we require. So SPF of 15 will not work. Okay, there are many fancy and very cheaper sunscreens available. So SPF 15 is as good as not using a sunscreen. So don't waste your time and money on it. Use a sunscreen with an SPF 30 or more.
Okay. Yeah. Thank you so much.
Yeah, and how much to apply is another thing. People use it like a makeup and very minimal. No, that is not the quantity we use. A 2 rupee coin in India is the quantity that is required. So maybe a coin size, not this much, I think. Yeah, it would be a 2 rupee coin size bit of sunscreen quantity required on the face. And if you feel you're looking a little white, just dab it off with a tissue because it gets absorbed any which ways in a few minutes. Yeah.
Okay, that's interesting. I didn't knew that. Thank you so much. So we go to the next issue that is called, which is a sagging and loss of plumpness during menopause. What do we do with that? Sagging of
Sagging and
loss of plumpness.
loss of plumpness,
Yes.
sagging of the skin.
Yes.
Yes. So that's exactly what we said is, you've got loss of volume happening, loss of collagen happening. So to be honest, the least invasive stuff is doing facial yoga. Okay. So face yoga is something, I'll just teach you the bare minimum what we do every day. So the first is you massage, keep your hand on the top of your head and fix it on and see that the skin is moving round and round. Okay. So clockwise and anti-clockwise. See that the skin is actually moving now. Then you do it at the back of your head also. Clockwise and anti-clockwise. Then keep your thumbs on the temples and just gently rub your forehead. We don't need to really massage it because what I'm training is the lymphatics of my face. Lymphatics need a very feather touch. So just a feather touch from left to right, left to right. Then pinch your eyebrows. Okay. Just pinch that eyebrow area twice or thrice. Just pinch this area. Yeah. Then, of course, we can take our fingers and you know how to massage around the eyes. Okay. Do it clockwise. Do it anti-clockwise. Okay. Then go around the upper jawline bone. Yeah, the cheekbone. The cheekbone. You go upper line. Then you rub your nasolabial over here.
May I request the participants to come on video and try this because this is something we have to daily do. I'm putting you all. So we can try from the.
You've done this. Now make your a V shape from with your fingers and just cross your lips like this and move upwards. Just swing this across your cheeks. Okay. Swing it like this. Yeah. Like that. Then keep the V. Go one in front of you and one behind your ear. And sweep it down your jawline.
Okay.
Okay. Sweep it down your jawline. And then look up and gently rub your neck upwards. And then just rub your head up to just go gently across your face and up down. There's another very simple exercise we do for, preventing these neck lines from forming is you look up, open your mouth and close it by pulling the lower jaw up and clench your teeth like that. You can feel the tightness in your neck.
Yes.
And then release that. So when you do that about 2 to 3 times, each time you look up, clench and again lower down and touch your neck to the chin to the neck. Doing that will tighten the neck muscles because we normally ignore these muscles. We normally worry about our larger muscles of the body, and the face has got a lot of muscles. So we need to exercise them also. Another one to tone up the collagen on the skin is the monkey pose, where you just blow in your air and fill the air into your cheeks on your upper lip and the lower lip and hold it for a few seconds or a minute if you can. And release that. Do that 2-3 times. So when you do that, your cheeks are automatically getting full. So these are natural ways of toning up your face muscles. And yes, we have retinol as a magical cream nowadays. You will find it in every country. So a retinol cream is a derivative of vitamin A. It's harmless. Okay, but it is not a retinoid. Now that is used for acne scars and all that. But retinol is an anti-aging serum that actually works on the epidermis, goes inside, and also plumps up your collagen. So it does remove fine wrinkles and works on your volume pretty well. So it's a very simple regime that you can follow using retinol serum at night. Most retinol serums will have vitamin E or a hyaluronic acid in that. So that cream you can use all over your face. However, for the under eye, I prefer you use a very specific under eye cream, because there they take care of the skin over here is very thin. You can't use something strong there. So they anyway take care of all that issues. So an under eye cream separately, on the face a retinol cream at night, and in the morning you could use a sunscreen. Before a sunscreen, I always recommend a vitamin C serum. Okay. So in the morning, after you washed your face with a gentle cleanser, apply a vitamin C serum, which could be a 15 to 20% vitamin C serum of any reputed brand, and it disappears into the skin in seconds, and top it up with your sunscreen. Okay. And this is your regime, very easy to do, and follow it every single day. So that's very easy to do. Now, suppose you want something more, like Bhairavi is a model, and she would want to look young all throughout till her 80s maybe. So then there are different procedures that people do. You have threads, you have lasers, you have a lot of facial rejuvenation with Botox and fillers that can be done, that can stretch your skin tight and make your wrinkles all disappear. So you could do all that, but that is each one's choice, a personal choice. One can do that.
Okay, so but all these are safe to do, like the laser and all of these are the names you have given, they are all safe to do?
Yes, absolutely. So the regime that I just said, a retinol serum at night, followed by in the morning we use a vitamin C and a sunscreen, and a cleanser has to be a mild one.
Yeah, okay.
So this will work for all types of skins.
Yeah, the exercises were wonderful, and I hope this will help each one of us. And just a reminder to all the audience that you can put up your questions in the chat box and we will take up soon. The next question is related to the dark spots, and then we will go to the unwanted hair that we get during menopause. So what do we do with these?
Okay. So dark spots we've just covered, so how I treat a pigmentary problem on the skin would be, I first gauge whether the water content and oil content is good, decide a cleanser accordingly. And then see, there are many cleansers with the alpha hydroxy acids in that. So you have something in India called Aha Glow, which has beads in that, so they crush the beads and then you use it as a face wash. They're good for normal to oily skins, but in dry skins with pigmentation, you use only the Cetaphil cleansers and the gentle cleansers. You can use a cream like a retinol cream at night, because it peels off the superficial layers. So one night use a retinol, the next night use a depigmenting cream like with containing one of these products, kojic acid, glycolic acid, niacinamide, mulberry extracts. These are very safe to use on the skin, even on an everyday basis. So you could alternate it with one night retinol and one night with depigmenting cream. But morning sunscreen is a must. So vitamin C and sunscreen, that regime does not change, that remains. So this is how we follow for dark spots. And in case they are very troublesome, they're still going very slowly, they're not really disappearing, you can take tablets of oral glutathione with vitamin C. Now, I don't know abroad, is it internationally available over the counter? But here it is. You get tablets like Gluton C. You have multiple brands here that have glutathione 500 milligram. You can take that once a day before dinner, half an hour before dinner. And a vitamin C tablet that is very common, that the tablet that gets dissolved is a very popular one even internationally. 1,000 milligram vitamin C along with the 500 milligram glutathione will ensure a very beautiful glow on the skin. Pigmentation problems disappear over a period of time, of course. And even those with an uneven tone will have a very good glow with this. So this is a combination that you can take at night, half an hour before your dinner. This will help you clear your skin beautifully for the spots. If there's something that is still tough to clear, then we can, doctors use chemical peels, dermabrasion lasers, and other techniques or injectables to get the pigment out.
Okay.
Dr. Madhavi and Anjali, I'm someone who is scared of all these medicines. So anything like from home, like a curd, lemon.
Yes, so there are a lot of home remedies. The only thing is that when we use these cocktails, sometimes they tend to dry out the skin. And a skin that is prone to a pigmentation, that is a wheat complexion, if you use a drying substance on it and your skin goes dry, a little bit of friction will land up, giving you a pigmentation problem. So I'm not confident telling everybody as the blanket statement you can use home remedies, but yes, like if you've tried and tested at home, you've used curd, you've used lemon, and you've used honey, and that has helped you a lot, I will definitely say yes for that.
Okay.
Thank you.
Yeah, because being on the forum and not knowing everybody's skin type, I cannot say it will suit everybody. And all the ingredients, because many people use what is that chickpea powder. Basin is what it is called in India. It's very commonly used, and that dries up the skin tremendously. We've had people with eczema coming to us, so that's something I'm scared telling people just as a blanket thing.
So please also tell us about the unwanted hair growth that happens during menopause.
Oh yes. Like we said, females have these two hormones that make us more feminine, estrogen and progesterone, but we also have the male hormone testosterone in a very small amount coming up from our adrenal glands. So when the ovaries shrink and they've finished their output of estrogen and progesterone, our testosterone levels that are going uncountered are going to be showing up a little more in our body. So then you will have the male effects on our body. So what we're going to see is probably acne, a little bit of hair where we are not supposed to have hair. So hair in the beard area, we have loss of hair where we're supposed to have hair. So we lose our hair from the scalp. We have hair, around the breasts or around the pubic area, the line going to the pubic from the navel area. So these are, hair coming in areas that we're not supposed to be having hair in. Because of the hormonal imbalance that we're seeing. Now, how do we deal with it? If it is very mild, very mild facial hair, you could just bleach it and manage it on, 15-day basis with a bleach. But if it is more terminal and thick black coarse hair, one of the safest ways is to get a laser done. Today, we have very good lasers which are very safe. Yes, I'll just take that question, Sudha. So we have this, intense pulse dye laser, which is very safe today for facial hair. If people are not comfortable with a laser, you could do your own threading, waxing, or whatever you're comfortable with. But waxing is something I will not recommend to everybody without knowing how thin their skins are, because if your skins are already thin, that could be a little dangerous thing to do on the face. And if your skin is very loose and lacking collagen, it'll cause a little more of loosening by constantly pulling it up. With this thing. And does HRT help? Sudha, my friend, had asked, does HRT help in hair loss?
Dr. Madhavi,
it's okay, Devi. It's okay, Devi.
Okay.
Okay.
Go
sorry.
ahead. Go ahead.
I'll take that question, Sudha.
No, you can answer, please.
So HRT will definitely cause a shift in all these products, but I personally have no experience with HRT. Not a big fan of it because I'm more scared of the side effects. And how long will you continue that? That's my biggest question. So, just to feel better about it for some time, because there are safer and better techniques to deal with hair loss, even in menopause. And I'd rather not use a hormone therapy for that. Yeah. So coming to the hair loss treatment, these are the safer techniques to use. And the wax that we use on the face should not be the, the common wax that we use for the hand and legs. There's a special wax for the face. It's either a pearl wax or something that that is, the salonists know how to use that. So we can't just pick up the ones that we have at home and use it for the face. It will cause a fast hair growth. Those people who are treating their skins for acne, who have retinoids as creams being used, that also stimulates cell growth. That's why it may also stimulate hair growth on the face, which is very temporary and can be reversed. So nothing to worry on that either. Yeah.
Okay. So would you like to add something more to the acne problem that comes up, or is that over? Is that covered?
So acne, adult acne is definitely something that we counter. Even at 60, at 66, we do see adult onset acne. And definitely that would be hormonal, but we see roughly where and what the pattern of the acne is. So I have a quick gauge. This is something very personal, not in any textbook. From my experience, that if you see spots on your forehead, it is entirely due to dandruff. So we treat the cause to treat the problem. If I see a lot of acne only on the cheeks, it is something to do with my gut. My system is totally congested. It needs a detox. Okay. And if I see something that is on my jawline, it's a very sharp alert for a hormonal problem. Yeah. So this gives me a rough idea of what the person is going through. And we could go through any of this at any point of time in life, not just menopause. So, and then we treat acne with a retinoid cream, with the cocktails that we have, creams that are available over the market. Salicylic acid is one of the best ones. I know internationally these creams are available over the counter. They help to reduce the inflammation and the very large red rashes that are there. And remember always to use a sunscreen when you're treating it. So sunscreen in the morning is a must if you're treating it.
Okay. Actually, I have few more questions, but we'll take up the audience questions first, and then if we have time, I'll get back with my questions.